Donna Kerper doesn't let much slow her down and always has an idea of what she'll do next.
I'm busy all day long. I have a fireplace. Uh, Sometimes I've split my own wood, carry it in, all day long. I do yard work. I have a garden in the summertime.
But in 2019, the 63-year-old was left with little control of what would happen next when she had a sudden seizure.
I had no symptoms at all. The day before, I was up in a tree stand with a rifle. I came in to write out Christmas cards, and I had a seizure. I never had one before. I never want to have one again. And I waited till it was over. I went to the neighbor and the other neighbor, nobody's home, drove myself to St. Joe's Hospital.
And in the emergency department, she had a generalized tonic-clonic seizure. She was given medications to stop the seizure. And then she went on to have a number of diagnostic evaluations, including a head CT and MRI of the brain. And they showed us that there was a metastatic tumor in the left frontal lobe. And that means a piece of tumor, some cell, has sailed up a blood vessel and parked itself at one place in the brain. In some unfortunate circumstances, it's showered, and there's multiple places in the brain that have tumor rests. In this case, it was just one.
The cells came from Donna's previous breast cancer.
You can have no symptoms. I thought my cancer was arrested. I was stage 3 on diagnosis back in 2013. I had radiation, I had chemotherapy, I rang the bell, Little did I know, 5 years later, 6 years later?
She's admitted to the hospital in the care of our hospitalists, and oncology, neurosurgery, neurology, the whole gamut of subspecialties required to care for her weigh in. Get the imaging studies or diagnostic tests that are important. If somebody has a cancer and now they have a presentation in their brain, well, maybe it spread somewhere else, to a liver or to their spine.
Within the week, Donna had surgery to remove the lesion.
Imaging was obtained so that she could have a surgery that was also guided with a stereotactic navigation, so that we take the information from CT and MRI images, feed it into a computer, and that surgery can very precisely locate the tumor. Now, this is very helpful if somebody has a tiny tumor that you have to have a very selected location for. In her case, it was just so to precisely open the head, doing the craniotomy, so that just the tumor area of brain was exposed, no extra brain. So to know exactly what the tumor is as you're making that approach, and to understand how far you are within the tumor so that you don't go into more normal tissue.
Surgery was a success, but Donna and her team of doctors wanted to take no risks.
When you have that procedure done, I know that I could take out, in her case, everything that I could see looks abnormal, feels abnormal, and that the imaging guidance suggests that it's abnormal. But there's not a precise razor thin line between normal brain and tumor tissue. So we know that there are cells left behind, that there is the potential for regrowth in the brain anyway. And it usually requires subsequent care. So that's where our radiation and medical oncologists come into play.
Donna handles the continuing treatment the way she handles everything else: upbeat, ready to go, and grateful.
I'm not going to let it get me down. I'm not ready to check out by any means. I have a daughter, a grandson who's 10. He thinks of the world of me and I of him. You have to trust your doctors. I trust my oncologist. I trust neurology. I hadn't met Dr. Weaver before then, but his bedside manner, his demeanor was excellent. I could talk to him one-on-one. He was down to earth. The whole team was down to earth, not aloof. So it made it very, very easy. I found everything I would need at St. Joe's, Penn State St. Joe's, and Penn State Hershey. Why go anywhere else? They're supportive. They're innovative. They listen to what you say. They're professional. and they have time to treat you good and treat you as a friend.
You heard Donna mention Penn State Health Hershey Medical Center there. Because St. Joseph Medical Center is part of the Penn State Health system, Donna was able to get seamless, specialized care at Hershey.